there's two questions. Should they strike? Should they be paid more? I believe they should be paid more. I don't believe that I think it's a fair comment to say that they have been underpaid. Of all of the public sector workers who are dissatisfied with their pay and conditions, nurses are undoubtedly the ones I have the most sympathy for, way more than transport workers or any others. But I really don't want them to strike. I really don't think they should strike.
Why not?
Because when you're a nurse, you have a duty of care to patients. Patients are some of the most vulnerable people that we have in our society. We have waiting lists of 7 million people when it comes to surgery at the moment because of the backlog through COVID. I also think that the pay award they've asked for is unreasonable and they won't get it. Perhaps if they actually did have a more reasonable pay demand, they wouldn't be in the situation where they have to go on strike. I say that with a heavy heart. You know, I'm far happier condemning other people in the public sector that want to go on strike that make the most vulnerable suffer. But I feel with nurses, unfortunately, you are making the very people that you need to care for suffer the most.
But Marina, they have already been offered 4.75%, which is more than some other sectors.
Which is not enough. This is, I think, what's happened now for over a decade is the exploitation of their goodwill. They are running on goodwill. We are basically reliant on these people to just take on the extra hours, to just be stressed, to be underpaid, to not make ends meet, to basically provide our healthcare. Now, if you're going into hospital, I personally want to be faced or be dealing with a nurse who is not suffering burnout, who is not going home and worrying about making ends meet or having to go to a food bank, who is not stuck in the same job. I've got a friend who is a neonatal nurse. And she basically said that their conditions are awful. They're treated so poorly. She said she's got a person that's been in the same position for 15 years. She's unable to move. There's no flexibility. She's unable to move because to get to the next level, you have to work a certain amount of hours, which means if you've got kids, you need to manage a family, whatever, you can't move on. I just think they are treated appallingly.
Well, let's have a little look now on how much nurses actually earn. So this is a little graphic we've got. Now, starting salary for nurses, this is in England and Wales, so it's just above 27,000. You can see here, 20,000 just to your sort of early 30s. While most senior nurses are on nearly 55,000, so that's quite considerable. However, if you look at the average pay for nurses, now this was quoted by the Royal College of Nurses today in an article, they're saying it's about £32,000, which, Marina, would put them in line with the average salary for the UK anyway.
I don't think we're not talking about an average salary. We're not talking about an average job here. We're talking about the people that held this country together during the pandemic. We all went out and we clapped for them. Let's put our money where our mouth is. We can find money for so many things. We can find money for defence. We can find money for 37 billion for test and trace, which had no discernible impact, apparently. Find money for these people, because if you look at, for example, reasons why we've got problems in this country, one of the reasons is we've got people who are just opting out of the workforce because they cannot work because they are sick. They have got mental health issues, they've got physical issues, and part of that is down to our NHS that cannot tend to people. We've got 7 million people on a waiting list, which, by the way, is not a COVID thing, because we were at 4 million plus pre-COVID. This is a Tory mismanagement thing.
But that's 3 million more then as a result of COVID. So you have to attribute nearly half that waiting list.
Of course, but let's not pretend there wasn't.
I agree, but there's a big chunk towards that is COVID. And secondly, I actually agree with you. It is an above-average job that deserves an above-average salary. I also think there's other help that could be given to people in nurses' positions. For instance, you know, the ridiculous raising of the highest tax threshold that we saw a few months ago. I would be raising the lower end of the tax threshold, taking more of people on nurses' salaries out of tax. You could reduce fuel duty, so therefore nurses could get to work more easily. The fact that many of them are subject to things like the ULEZ, parking charges, there are other things that could help them. But 17% is not what they're going to get, and that is
Oh, come on,
not money
Krista,
that
you
could
know
be
how you
found.
start a negotiation. You go in high, and then you work your way back. You work your way to a middle
Marina,
ground.
you think that they deserve that anyway, that's what they should get?
I think they deserve it absolutely in line with inflation, and I think they deserve not to have seen a real terms pay cut. So
that's not
unfortunately,
17%.
but you know what? The reason it's so high, it feels really high, is because they have been neglected for so long, which, by the way, is by design. So honestly, what the Tory government does, and I think we need to be really conscious of this, is they make things, they engineer problems so they can swoop in with their private companies, which, by the way, have seen their profits soar because private companies with agency staff then come in, one of whom is Tory donor Lord Ashcroft and his company, who then supply these agency staff at premium prices rather than just fixing the problem, actually retaining and recruiting properly.
OK, well, we're joined now by a nurse who actually voted for the strike action. Good morning, Candy Gregory. Thank you very much for joining us and explaining to us what's happening. Are you a little bit concerned, though, that strike action would endanger patients? I think that's the biggest concern for people at home.
Yeah, I think the government already put us into danger. They've used the conscientious card, we're too conscientious to go on strike. Well, I think we've had enough of that now. Can I just address Christo with something? If you'll listen, Christo, yep. I'm speaking to you from my 3-bedroomed house here, and I managed to buy it because I bought it in the 1980s. And in the 1980s, I was paid a decent salary, so I could afford a mortgage. So I took home £800 a month, and my mortgage was £120 now. So nowadays, a full-time nurse, they would take home £1,600, rent, if you're lucky, is £1,000. So that leaves them very little. And I'm striking for my undervalued colleagues to have what I had, which was a decent salary where I was valued in my pay packet. We need pay restoration. Nurses, what they do nowadays far exceeds what I did 20 odd years ago. I'm still a nurse, but the technology, the stress, the responsibility when you're so short-staffed, this is about encouraging people to become nurse, encouraging people to stay as nurses. We are 50,000 registered nurses short.
But
and
Candy,
how are you going to address that?
Interrupt at that point, because I'm going to put the viewers' sort of feelings to you. And I think that a lot of people looking at your salary and the average salary being 32, in line with the average UK salary, would think that's an all right wage.
No, it's not, because most registered nurses are on what they call a band 5, which is the basic nurse salary, and that's where they spend their careers. These are graduate professionals. They save lives. They have enormous responsibility, and they prop up the total shortfall of NHS vacancies, which is 135,000 at the moment. So they're very, very overworked, underpaid, undervalued, and this government really needs to do something about this, because it's just unsustainable.
What you want them to do is offer you 5% over inflation, but I mean, nobody's getting that. Where's the government going to get that money from?
So Marina is exactly right. The government are privatising healthcare, the NHS, by stealth. So you have to appreciate that money that should go to direct patient care is going to shareholders, CEOs, dividends. So it's not coming to the patients, it's going to those places now. You can check this out on various websites and who's got dibs in private healthcare. You can also watch various films on YouTube, say The Great NHS Heist or Sicko or Grousel, those sorts of films that will show you what the government's doing and why they have to keep nurses' wages down, and doctors, of course, and physios, because they're coming, or they're balloting at the moment, and ambulance people. We're all in it together, trying to save the NHS and trying to look after patients, but we can't do it when we have to get a roof over our head and eat as well.